ready? Set, go. Okay, here's the front and the back of my MAR sheet. So that's the first thing I would do is check the MAR, check the 5 patient identifiers, so I would make sure I have the right medication. I do, I have Lasix, I have the right dose. It's gonna be 20 milligrams, so 2 milliliters because 10 milligrams per milliliter. Right now is the time. My patient is hearing crackles, so I'll check that when I get in there. Now I'm gonna do my hand hygiene. Okay, now I'm gonna go into my patient room. I'm gonna get my gloves. Those on. And then I'm going to ask my patient the name and date of birth and compare it to the MAR, and also check for any allergies related to the medication. They don't have any, and they knew their name and date of birth, so we're good to proceed. I'm gonna make sure I have everything. I have both my saline flushes, my alcohol pads, a needle, and medication. So now I'm gonna drop the medication. So the first thing I'm gonna do is drop 2 milliliters of air. Push that in, and then drop 2 milliliters of the medication. And safely cap my needle. Here we go. 2 milliliters of IV Lasix. So we're good to go there. Now we have our IV site. We're going to check it for any infection, any infiltration. We're all good there. I'm gonna clean the site for 10 seconds, and then I'm gonna let it dry. Okay, I'm going to unclamp it, and I'm gonna use my first saline flush to check the IV for patency. So I push 2 to 3 milliliters. Is it gonna spill out? Oh yeah. Okay. It's patent, so now we can clean it again for 10 seconds. 10 seconds. Let it dry all the way. Now we're going to inject our medication. Just take off the needle and attach it. And then I would push this 2 milliliters over 2 minutes. When that's done, take it off. Then we will clean the site again for 10 seconds. So we're going to let it dry. Do another 2 to 3 milliliter saline flush. It just came out of the patient's arm. And then we're going to lock the IV. Then we're going to assess the patient, make sure they're feeling okay. Then I'm going to take off my gloves. Hand hygiene. And then I would document everything in the MAR on Epic.